Steve, and I'm here with Dr. Tom Hayhurst. We're at the healthcare rally downtown. What's going on today, Tom?
Well, we're trying to get the word out that the majority of the American people favor affordable health care for all Americans. That's our goal, affordable health care for all Americans. There's no question that's what America wants, and we're trying to fight some of this bizarre propaganda about government takeovers, which is nonsense.
And you've seen firsthand the results of poor health care, or non-existent health care. I know
Absolutely.
You were sharing a story with us earlier.
Yeah.
And yeah, I mean, it must be heartbreaking to see that on almost probably a daily basis.
Well, you know, there are good numbers out there. There's something like 18,000 people in the U.S. that die every year because they don't have affordable health care. And I think in our country that's a travesty. We've got to turn that around. I have seen specific instances every few months when I was in more active practice taking care of critically ill people, of folks who would like take their kids' antibiotics off the year-old antibiotics off the shelf, hold off as long as they could until they were on death's doorstep, then go to an emergency room and maybe not make it. I mean, that should not exist here in the United States of America. And there are more and more people boxed into that situation.
I hear the argument that maybe people should just read through the health care bill.
Yeah.
Do you think that plays into this to a great degree? Do you think it's people just making generalizations, or how much of it's informed opinion?
The whole, you know, the details of the health care bill are in a state of flux. If you read for one health care bill, then you can sit down and read the other health care bill and another health care bill and another health care bill. But things are generally boiling down to the basic overall concepts. I think the basic general concepts make a lot of sense. And whether it was on city council or if I'd happened to have been elected to Congress back in '06, yeah, when the final version began to near fruition coming out of committee, I would definitely have read every single word. But the question is, what about the overall principle? Are we going to cover everybody? We need to make sure everybody's covered. And is it really a problem for the government to be involved with health care? What about 42 million people on Medicare? 42 million people on Medicare, it's very popular, it's a good solid program. And what about 14 million veterans who served our country being on a federal program, a federal health care program? I mean, I think some of the people marching around here today, apparently they want to take health care away. This federal program, health care, they want to take that away from our veterans. And I think that's a travesty. The federal government has a role in health care. This is an insurance agent. That's basically all we're asking.
How much of it do you think boils down to kind of the haves versus the have-nots? Do you think that plays into this as well?
I think that's big, because I've said and I've lamented many times that since I was a kid, we shifted from being the we society. We're going to look after our neighbors. We're going to help. We're going to get after our neighbor's kid. If he comes down and he's throwing rocks at the dog, we're going to call his mom and dad and get involved. The we society to the me society. I think there are a lot of people that are just focused on them, their own pocketbook, to hell with the country and to heck with everybody else, who apparently don't care if 18,000 people die because they don't have health insurance. I think we need to get back more to the we society, where we show some concern about our next door neighbor, not just me. We need to work together.
Dr. Tom, it's always a pleasure to talk with you.
All right,
Thanks for your
thank you
time.
for doing this.
Yep.
Appreciate it so much. You bet.